Okay, I'd like to call to order this meeting of the First Five Sacramento Commission for Monday, February 4th, 2019. Madam Clerk, will you please call the roll? Establish a quorum.
Dave Gordon.
Just me.
Here.
Beth Hassett.
Here.
Terrence Jones.
Here.
Hisiri.
Here.
Bruce Wagstaff.
Here.
Scott Moak. Donna Snaringer. Steve Wertz.
Here.
Lee Turner Johnson.
Here.
Kathy Cossack.
Here.
Terry Porter. Christina Elliott.
Here.
Patrick Kennedy. Phil Cerner.
Here.
We have a quorum.
Great, thank you. Please,
This-
go ahead.
This meeting of the First Five Sacramento Commission is cablecast live on Metro Cable 14, the local government affairs channel, on the Comcast, Consolidated Communications, and AT&T U-verse cable systems. This meeting is closed caption and webcast at www.sacmetrocable.tv. Today's meeting will be repeated Wednesday, February 6th at 9 a.m. and Friday, February 8th at 2 p.m. on Channel 14. Members of the audience wishing to address the commission may sign a speaker slip at the kiosk located in the back of the room. Please include the agenda item number that you wish to address and then bring the completed form to me. Please speak into the microphone when addressing the commission and state your name for the record. If you have any electronic devices, please put them on silent or turn off now. Thank you.
Thank you. Dr. Jones, will you do us the honor of leading us in the pledge, please?
I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, again, I'd like to welcome everyone to this afternoon's First Five Sacramento Commission meeting. And for those that may have just joined us in chambers, again, if you wish to address the commission on any item on our agenda or off our agenda, you're welcome to do so. We only ask that you please complete a speaker slip located at the back of chambers and give that slip to our clerk, and we'll call you up in the order received. We do ask that you keep your comments to 3 minutes. That way everyone has a chance to address the board if they so choose. With that, our first item, please.
First, Christina Elliott will be voting for Scott Moak since he's out today.
Okay.
And item 1, approval of December 3rd, 2018 draft action summary.
Okay, does any member of the commission have any changes? If not, then I look for a motion.
I move to approve.
It's been moved by Commissioner Jones. Chair will second. All in favor? Aye. Opposed? Abstained? Motion carries. Thank you. Next item, please.
Public comments on off-agenda items.
Okay, again, this is the public's opportunity to address this commission on items not on our agenda. I am not in receipt of any speaker slips, nor do I see anyone approaching the podium. So with that, we will move on to the next item.
Executive Director's Report.
Okay.
Good afternoon,
Good afternoon.
Commissioners. Pleasure to see you all. I have started off your Executive Director's Report with an update on some of the Governor's proposed budget for 2019-20. This proposed budget sets a bold new direction, allocating over $2.7 billion for programs and services that really advance First Five's policy agenda. It's very exciting. There's a brief description in my report of each of those programs, but the highlights really are a focus on home visiting, reducing child poverty, expanding services around early learning and early care, and increasing paid family leave time for bonding with the child. So some really great stuff happening in here, including expanding the Black Child Health Program. All of these services are sort of key to the governor's long-term plans, his roadmap, if you will, for improving not Sacramento, but California for young children and their families. In addition to the services, he's also made 2 key appointments that I think would be of interest to you. One is he created a new position for California, our first Surgeon General, and has appointed Nadine Burke-Harris, who you probably all know is an expert in trauma-informed care and a pediatrician. And then also Chris Perry returns from her time in the nation's capital working on the Obama administration. She was the executive director of the First Five California before taking that position. So she has a very strong First Five background, and she is the Deputy Secretary, Deputy Secretary of Health and Human Services Agency for Early Child Care Development and a senior advisor to the governor. So excellent 2 new appointments, really looking good for First Fives and for young children at the Capitol. A few highlights on our 20th anniversary. Kind of stated this earlier, but we all know that today's toddlers are tomorrow's nurses and engineers and commissioners, and they're our future workforce. And so what we do with those kids now is super important. And Sacramento really needs an engaged workforce who understands the importance of the first 5 years. And our 20th anniversary celebration, Raise Up Sacramento, that was our key strategy to bring in the business community. We celebrated on January 28th. Commissioners were joined by 174 attendees, and those attendees included 24 elected officials, 75 members of the business community. So we're really happy about that. 17 First Five partners, 47 individuals from local and government agencies, and apparently 11 random people that we just let in and are still trying to figure out who they are. We were successful in securing over $24,000 to cover the cost of our event, and those were with some key business sponsors. We're very happy. This was our first venture into sponsorship. And as far as media coverage, we had CBS conducted an interview with Chair Cerna prior to the event, and then KCRA came to the event and interviewed commissioners and participants, took a lot of video footage. The event was also featured in Sacramento Business Journal's website and in N Magazine, and Channel 13 published the photos of the event on their website. So we had a ton of great media exposure.
Before you move on, I just want to issue my forceful thanks, my strong thanks to Erin in particular for Erin Murray. So she's done an outstanding job getting the public familiar with First Five, and I think part of the event certainly was to bring the business community closer, not just for an evening to First Five, but structurally. So I think mission accomplished, and I know she really went over and above in terms of making sure all the event details were taken care of, and the marketing in advance of the event was robust. So great job.
Yay. And she made it look easy when we know it's anything but easy. Like, there was a smile on her face the whole time, and it was something else. So yes, thank you to Erin. She just weaved some magic that evening. Thank you to the commissioners too. You helped all along the way with the sustainability committee, helping in the planning of the event, and then you so kindly shared your business contacts with us and helped us recruit the business community in there. That made a huge difference. And so we're just so grateful for you, for Erin, for the whole First Five Sacramento team. Everybody had a hand in making it a really successful event.
Thanks to Assemblymember McCarty and Senator Richard Pan. They presented us with a joint resolution acknowledging 20 years of great work in the community, and so we really appreciated being flanked by our state representatives as well.
Yeah, we're finding a nice place for that in the office. You'll see in your at your desk area, there's a copy of our Raise Up Sacramento Cradle to Career. We call this our pledge sheet. instead of asking the employers to pledge something to us, this was actually our pledge to them, that we're here, we're ready to work with anyone who wants to take the next step in moving their business forward as a family-friendly business, be that creating policies. Wherever they're at, we're willing to meet them there and help them further. And I did now want to share with you our Raise Up video for those of you who weren't able to make the event. The video features Christina Elliott and Chair Cerna. It was created for the 20th, but it's actually going to be used kind of extensively from here forward as we continue to reach out to business. It's on our YouTube, on our video, on our website. And so if we can cue the video, please.
Another sound.
We're not seeing it or hearing it out here.
Is there a control at your disposal there?
Parenting, early childhood. Here in Sacramento, we are a community on the rise. We are a place where change is welcome and growth doesn't just happen on the farm. But in order for us to be a place of progress, we as parents, advocates, elected officials, and business leaders must come together to prioritize positive parenting, early childhood education, access to health care, and access to quality child care. When our families get the support they need, we will be able to provide solutions to prevent child abuse and neglect. We will be able to prepare thousands of students for their first year of school. And we will also be able to advocate for working families in need of affordable quality childcare. Which is important because what happens during the first 5 years of a child's life will eventually affect us all. There is no better time than right now to join First 5 Sacramento. Because the sooner we collectively put kids first, our positive parenting efforts will lead to safe children and thriving families. Our access to healthcare will decrease social and medical costs. And our early childhood education programs will inspire a more skilled workforce, enabling our community to rise. Here's to supporting our future leaders, thinkers, and dreamers. Here's to supporting our kids in the first 5 years.
The first 5 years. The first 5 years.
The first 5 years.
First 5 Sacramento. When we come together for children ages 0 to 5, we all rise.
And just for the record, the original video we had shared duties. Christina and I had shared duties for voiceover, and when I heard myself, I'm like, Christina has to do the whole thing. So you made the video. So thank you, Christina.
Great.
May I just add,
Yes.
our messages are sorry. Our messages are so optimistic and so future-oriented, and they're so well done. I mean, it's a joy to see them on a variety of formats, so congratulations. And it's no wonder that the governor has chosen the policy directions that First 5 has been involved in for the past 20 years to highlight and to further fund. So great job. Proud to be a part of it.
Thank you.
Thanks.
Thank you. It's a fantastic event. Our partner in this event was RSE, and I think their expertise shows too in pulling together and just really putting a lovely bow on the whole thing. I have just a couple more highlights from the executive director report before we jump into our other agenda items. A quick sustainability update for you. Last week on the 29th, we had more than 60 of our funded partners joined us over at the Sierra Health Foundation, including Commissioner Hassett, to really take a deeper dive into certified sustainable We were joined by Camille Mabin from First Five California and by Moira Kenny from the First Five Association. It was just wonderful to see the enthusiasm in the room. Our partners were everyone from the executive directors to key line staff to their CFOs and CEOs, and even board members showed up. So it was a pretty great day. And the agencies, a draft of their sustainability plans are due to the commission next week for review. So excited. We have some members of our sustainability committee that will be joining us to review those draft sustainability plans, and then we'll provide technical assistance and feedback to each agency on their plans specifically. You should all also have a flyer at your desk side around the fourth annual Pride and Joy baby shower. That's taking place on the 23rd, February 23rd at Fruit Ridge Community Collaborative. We expect over 100 pregnant women and new moms to attend. And we are continuing our partnership with the Kings and with First Five California. We'll have a special guest appearance from a Kings legend, Olden, and I'm not going to know how to say Olden's last name. Someone help me. Yes. He will be at the Pride and Joy baby shower. He's a Haitian American father who played with Sacramento Kings from 1992 to 98. He's an advocate and a spokesperson for young people with disabilities. We're also planning a Kings event on March 1st for Dr. Seuss Day. This is a repeat of a really wonderful event we did last year. This time we're going to partner with San Juan Unified School District. We'll send out more details for you then. And that concludes my executive director's report.
Great, thank you, Julie. Any questions for our executive director? Okay, seeing none. I would encourage my colleagues, if you have not been to one of our community baby showers, this is your opportunity. It is something to behold. The amount of energy in the room is pretty phenomenal, and the amount of resources that first-time mothers-to-be have is pretty extraordinary. And I would also humbly request that if you happen to engage with social media, please do as I have and link to that is the First Five Facebook presence around Pride and Joy, so that we can maximize public interest in this. So, thank you.
Thank you.
All right, next item, please.
Advisory Committee update.
Okay, is Robert here? I'm assuming. We're not having an advisory update?
Oh, no, I'm sorry. We did not have an advisory committee meeting.
Okay.
Our next one is coming up in a couple weeks.
Okay, evaluation?
Evaluation Committee update.
Yes, thank you. We met on January 14th, and we almost had a quorum. Dr. Casari has joined us by phone, and I was informed that that wasn't sufficient to be considered present. So we were just short of our quorum, but we really appreciated her joining us and look forward to her involvement in the future. Plus, we look forward to the new advisory committee members being there next time as well. And so we spent our time reviewing and providing feedback to both staff and consultants around the evaluation report that we're going to hear about today. So,
Great, thank you.
Financial Planning Committee update.
We met on January 17th and reviewed the quarterly financials from December 31st and found they were in line with the budget and forecasted expenditures. We also reviewed an update on recent efforts to implement the new collaborative partnerships with Department of Human Assistance for the CalWorks program and the Department of Health Services for the Perinatal Equity Initiative. And the committee discussed the allocation adjustment request that will be coming forward to this commission in March of $2.3 million. We approved that to recognize the new revenues and expenditures that will be generated from the collaborative partnerships. And we also were invited to assist staff as they looked at the new online database system for the Medi-Cal Administrative Activities Time Study.
Great, thank you.
Sustainability Committee update?
I'll go ahead and do that. So much of what was in Julie's executive director's report is what we would have to update on. So we're really excited about the direction that our governor is taking with his budget. We also agree that the Raise Up event was very successful, and it was an honor to be in that video, and my kids feel very famous, so that's fun. And your voice was just fine, Chair Cerna. It was really good. And then, we are looking forward to the Certified Sustainability Initiative, that Julie updated. So there's more to come on that. And our next meeting will be February 19th or 20th? 19th. And then, so we'll be looking at some of that and excited to continue to build relationships with employers now that we have our first event with them kicked off. And I think we all kind of did a good job of networking and making contacts with those folks. So I think that we'll be having a lot more to discuss with how those initiatives are going forward in the coming year. So we're excited about that. And then one last thing, Bob Silva has transitioned off of the committee, and our new advisory committee member is going to be Katie Andrews from Children Now. So there we go. Thank you.
Thank you. Okay, next item, please.
Approve $50,000 contract amendment with ASR to include evaluation services for CalWorks Home Visiting Initiative.
And back to me. So I am asking for authority today to execute a $50,000 contract amendment, as stated with ASR, to provide our expanded evaluation services for the CalWorks Home Visiting Initiative. The CalWorks Home Visiting Program requires us to do some data collection and reporting and to the state of California. So these evaluation services are in service to that. They will be funded through the 5%, 6%. Sorry, Eric, what percent did we take?
5%.
5% administrative fee that First Five is receiving from DHA as part of our oversight. So we are taking $50,000 of that and asking to allocate that to ASR to evaluate the program. They will, for that amount of money, implement new activities, including the development of results-based accountability framework for the CalWorks Home Visiting grant. They'll develop data collection tools to be implemented by the Child Abuse Prevention Center, and the creation of 2 evaluation reports covering the first 30 months of program implementation. So to conclude, staff recommends amending the contract with ASR for the term of February 11, 2018 through December 31st of 2021 to increase the contract by $50,000 to provide additional evaluation services for the CalWorks Home Visiting Initiative.
Great, that concludes your report?
Yes, sir.
Okay, any questions for staff? If not,
I'll move the item.
okay, Commissioner Gordon moves the items.
Second.
Second by Commissioner Wagstaff. Roll call vote, please.
Dave Gordon,
Aye.
Beth Hassett,
Aye.
Terrence Jones,
Aye.
Olivia Kasiri,
Aye.
Bruce Wagstaff,
Aye.
Christina Elliott,
Aye.
Phil Cerna.
Aye.
Motion passed.
Very good, thank you. Next item, please.
Approve revenue contract with Sacramento County Department of Health Services for the Perinatal Health Equity Program and authorize amended contract with RSE to conduct related services effective February 11th, 2019 through June 30th, 2019.
Mr. Chairman, I need to recuse myself on this one.
Okay, let the record show that Commissioner Wagstaff is recusing himself from this, and looking to my left.
I need to recuse myself. To recuse myself as an employee of the department.
Okay, and let the record please show that Commissioner Kasiri is also recusing herself. Thank you. Okay.
Yes. So I am very excited to bring this opportunity for partnership to the Commission. The recommendation before you today expands the Commission's collaborative relationships with the county, with various county departments. We currently have a partnership with the Department of Human Assistance for CalWorks and the Department of Children, Family, and Adult Services. And now I would like to expand that to include the Department of Health Services. This specific funding is short-term funding in our strategic plan result area of reducing African American child deaths. As you know, our collective impact efforts with our partners at Sierra Health Foundation, RSE, Her Health First, and WellSpace Health have had an impact in decreasing infant mortality rates for African American babies in the county. And we've been invited by the Department of Health Services to partner in a planning grant, short-term planning grant, to learn more about other specific strategies or approaches that could enhance what's currently happening in the county, and as well as the Black Infant Health Program. That's a state-funded program. I am asking the Commission to adopt the attached resolution authorizing the Executive Director to enter into an agreement, a revenue agreement, whereby we accept $300,000 from the Department of Health Services, and that we then have an expenditure agreement where we subcontract $275,000 over to RSE to implement some of the activities. A quick note before I jump into the background and discussion section. We did discover late last week that the state is allowing us a little more time on the contract. It was just going to be until June 30th, but they are allowing us to expend the money through September 30th of 2019. So your commission letter and the resolution says the ending date of June 30th, but I'm going to request that you amend that to the September 30th date. That just gives us a couple more months in order to get the work done. Last year, the governor recognized the continued statewide gap, the disproportionate deaths among African American children in the state, and signed a piece of legislation that established a new program called the Perinatal Equity Initiative. And it's through the California Department of Public Health, and it's to promote the use of specific interventions designed to fill gaps in the Black Infant Health Program. The Department of Health Services, the Sacramento County Department of Health Services, received notification that they had been awarded funding, close to about $600,000, and then they received board approval to accept that funding recently. So it was a very proud moment because DHS recognized First Five's contribution to this effort and approached us to enter into a partnership to work not only with us to implement some of the activities in the PEI work plan, but then also to utilize RSE as a main partner in this work, especially around the campaign to reduce African American child death, and potentially some of our partners through a subcontract with RSE. A collaboration with the Department of Health Services would allow First Five to take the lead in establishing an advisory committee. We would sort of morph a current group that we have right now into becoming a Perinatal Equity Initiative Advisory Committee so that we could learn more about what's happening in our community and specifically some approaches that might work to address the issue. So we would use $10,000 of the $300,000 to create this advisory committee and then convene meetings of it during the year. And then we would subcontract out $275,000 to RSE to specifically work on the campaign piece and some other activities. We would take a 5% administrative fee of that $275,000, which is the equivalent of $15,000. And then RSE would use that, their money to not only do the campaign, but also dig deeper into how best to raise awareness around the preterm births, health inequities, maternal and infant mortality rates, and the promotion of health activities that contribute to healthy and full-term babies. And in addition, RSE we could envision them subcontracting with one or more of our RAACD partners, which is why we just sort of listed everybody in your conflict of interest section, because we weren't really sure which ones RSE would go with to do some of those activities. So we just kind of left that open. And in conclusion, staff recommends that the commission approve the item with the modified term for the revenue agreement to begin February 11th and to go through September 30th of 2019.
Great, thank you.
You're welcome.
Mr. Heyer.
If it's the commission's pleasure to accept the resolution, I suggest that on the paragraph that begins, "Be it further resolved," the last word should be plural, it should be agreements, not just agreement.
Okay. Okay. I don't have anyone sign up to speak on this matter. Is there any questions for Julie? If not, entertain a motion. And the motion, again, would include the suggested language by our council.
I'll move the item as amended.
Okay, it's been moved by Commissioner Gordon, seconded by Commissioner Hassett. Roll call vote, please.
With Olivia Kassiri being recused, Kathy Cossack will be voting in her place, and there's no one for Bruce Wagstaff today. So Dave Gordon?
Aye.
Beth Hassett?
Aye.
Terrence Jones?
Aye.
Kathy Cossack?
Aye.
Christina Elliott?
Aye.
Phil Cerna?
Aye.
Motion passed.
Okay, very good. Thank you. Next item, please.
Presentation of the fiscal year 17-18 annual evaluation report.
Fantastic. We have some great information to share with you from our evaluation report. Our partner, Lisa Nikolai, is here from ASR to go over those results in a quick PowerPoint.
The key word being quick.
No, we have time today.
It's a fairly quiet day in the chambers today, so when I walked in, I thought, that means I have more time to share data with you all. Just kidding. Okay. All right. And I am going to watch my clock. I'll try to keep it to about 20 minutes or so and not speak too loudly into the mic. So I'm Lisa Nikolai with Applied Survey Research. We're the evaluation partner for First 5 Sacramento. And prior to the last 3 years of doing that, we were your school readiness research partner. So basically, we love data. And I just have to say, it's so great to hear about new initiatives being conceived of and being developed and funded, because we're right there next in line to catch those and help measure those for you. So very exciting work. And I need to turn my own slides, don't I? There we go. Okay, so first let me just talk about the goals of the evaluation. As you know, evaluations can take many different purposes. They can be formative, they can be summative, they can be longitudinal. I would really call this a very classic outcome evaluation. We're really trying to just stay focused on some basic metrics per program, per investment, to make sure they're working for you. So Julie, when Julie came on board a couple years ago, said, let's use a results-based accountability framework for that, just liking the clarity of that framework. So for instance, we have metrics in place for every funded effort that looks at how much was done, basically the volume of work, as well as how well did that work take place? Is it quality? Is it worthwhile? And is anybody better off? Are there outcomes being produced from that work? So it's not to say that we're doing longitudinal studies, for instance, on everybody, but just trying to see, did that program have the effect or the impact that we thought it would on a short-term basis? But as I say that, the other great thing about results-based accountability is you're holding off on the horizon some community result or community condition that you're trying to influence or contribute to. And so we're leaning up our ladders of our interventions up against those community curves, and we hope to see those change over time. We gather these data because we want to help you celebrate successes, and we have many. You're going to see in the charts in a few minutes, but also sometimes things don't work as planned. And that's why we have those detailed metrics around how much or how well, because those are our red flags that tell us if something's not quite right. We can give that data back to you, and you all do some course corrections so we can really get the impact that we're hoping to see. Okay. And how do you like the clip art little man there? I like that guy. Okay. So in terms of the strategic hierarchy, I know you've seen this diagram every year in the presentations. This is the framework that guided both the program investments as well as the evaluation over the past couple years from 2015 to 2018. But I should say that going forward as a result of the strategic planning process and really having to make some tough choices and winnow in and hone in on where First Five could have its best impact, I believe we took off 5 different results, went from 15 to 10. So you're going to see more streamlined framework going forward. But today I have data for you on most of those results. You also should have the report in your packet. There's a lot more there for you to work through. Okay, let's get to some data. So the first bit of data is just to look at some reach data. So we gather client data with a partnership with Carmen, of course, around both duplicated clients that are served as well as unduplicated. And I actually love both of those metrics because duplicated clients tells us how many unique client contacts did we have. And actually by design, we hope that service components are cross-referring. We want to see people serve through multiple doorways. So what we saw across a couple of years there is that around 55,000 or so clients had duplicate or had touches with the different First Five components. And then when we look at unduplicated, that means we're only counting somebody once, no matter what program or programs they had contact with. And so there you see about 25,000 clients per year, dropping down a bit toward families, about 15,000, and then for children, that's also around 15,000 a year. We're seeing some slow uptakes over time. But the thing to point out is when we look at how many children you're reaching as a percentage of all the Sacramento County children 0 to 5, it's about 13% of reach. So that's great. That's a number you should feel proud of. Okay, so in terms of who you're reaching, we don't have a lot of demographics at our disposal, but we will have more in this coming year with the new family intake form being updated. But in the previous years, we had basically demographics in terms of ethnicity and age and language. So just looking at ethnicity there, you can see that a higher proportion of the children served by your programs are Hispanic, Latino, or African American, and less likely to be Caucasian. So basically, you're reaching into more diverse populations. Okay, so now I'm going to start to take us through some desired results per your strategic framework, and there's a lot here, so I've taken the liberty of combining some results together. So first, in terms of access to health and dental care, a couple different programs we wanted to highlight here for you. So first is Hearts for Kids. We've presented to you about this in recent years and past years, and so this program was funded in a partnership through Sacramento County Child Protective Services for kids 0 to 5 that are moved out of the home, and those children get health screenings, really a head-to-toe medical clearance, and get a home visit with a public health nurse. And over the 3-year term, we saw about 1,300 children being served through that program. And what was interesting is looking at the needs of those children and how they were referred to care. So what we saw is about 70% of children across the years had dental needs. So that's really high. And they were referred for services. And then we also saw about 50% of children had developmental needs as flagged by an ASQ, and they were referred to services as well. So just last year, you asked us to bring you comparison data points where we could. And so just for context, that's 50% of our kids being flagged in that program compared to about 17% nationwide as a flag rate for ASQ. So that shows you how much more at risk those children were in that program. So good work of that program to connect them to services. The second program to highlight for you is Sacramento Covered, so touching an astounding 20,000 folks over the past 3 years, really trying to understand through their intake process what those barriers to healthcare were, whether it be medical or dental, and work through those barriers with families. And what we saw, and as you see in the chart there, is that they had good success, especially on the medical front, but getting connections on the dental front was harder. This is something that's not unique to your county. We see this in every county that we work with, largely due to the lack of supply of Denti-Cal providers. But basically, of those who didn't have health insurance, 79% were connected. Those who didn't have a primary care provider, 71% were connected. Those that didn't have a dentist, almost 50% were connected, so that's good. 50% were not, so we want to work on that. And then getting children in for that dental visit. About 48% had a dental appointment. Okay. So
Excuse me,
smile.
real quick, Commissioner
Yeah, please.
Wagstaff, I think, has a comment or question.
Thank you very much, Mr. Chairman. What I'm just trying to get a handle on as you go through these numbers, and you sort of spoke to this a little bit, but when I look at these numbers, compared to what? In other words, are we hitting a goal that we set? Are we below the goal that we set? that kind of thing. Could you shed some light on that?
Yeah, that's a good target, and I'll make a note of that for the coming year. We do have performance measures set in place for a number of clients reach. For instance, I was thinking of some parent education stuff that I saw for Birth and Beyond. We did have a target of X number percent should complete 80% of the workshops. So we do have those in place here, and those are, you can see some of those in the RBA dashboards, but I'm not bringing them in here for you, but I'll try to do a better job on that next year. Does staff want to add to that?
I can add a little bit. If you're talking about dental checkups, so this is after a family was connected to Sacramento Covered, about 46 or 48% of them had a dental checkup after that being connected. In the county as a whole, for 0 to 5, that percentage is closer to like 20 to
Correct.
25% of children.
Yep.
So they did do a good job in connecting the kids that they saw. It's still woefully low.
Right.
But it's higher than the countywide average. And then if you want like a comparison of, say, a private or what is the health insurance that someone has through their employer health
plan.
insurance, the standard rate there for I believe for California is closer to 55 or 65%. Dental.
I think more likely it's closer.
Your mic.
Oh, it might actually be higher.
It's
yes.
closer to the 71%, 66 to 71. So to me, I think it's a kudos to our programs that are actually being effectively referred to the dental program. Where the missing link is, once they're referred to the dental program, why are they not getting
Right.
treatment at the 77%? So there's your barrier that we would still want to address.
Well, just
you.
as a
Thank you
general
for that.
comment, as I reviewed this, as you go through these numbers, if there's a way to give us an indication of how that number stacks up against what we were shooting for, would be helpful in terms of
Great.
evaluating.
Great, thank
Okay.
you. Thank you. And Carmen also reminds me, I was remiss in saying this, but our report is structured per result area, starting off with the community trend to show you what that looks like countywide, and then below that we're describing how this program is doing, so I should have connected those two better, and then PowerPoint will do that next year. Okay, so over to Smile Keepers. So Smile Keepers is also what I'd call a high-volume program. So over the last 3 years, served about 23,000 children with oral health screenings, so about 8,000 a year. And Smile Keepers does those screenings at preschool environments or with WIC also, and also at community events in the community out there, and using a scale of 1 to 3 to basically rank the level of need that they're seeing in that oral health screening. We're looking at the percent of children who had either a non-urgent oral health need or an urgent oral health need, and combining those two categories is about 30% across the years had those needs. And Smile Keepers would also do spring screenings, and sometimes we saw a small improvement in those in the oral health needs, meaning that person had been connected to services. Go ahead.
Yeah, I think Dr. Jones has a question.
Yes.
You know, I don't want to belabor this, and I
Yes.
was perfectly willing to wait till the end and we can talk about it, but I just want to emphasize that with Smile Keepers, and in your detailed report, there's a couple graphs that I would like to go back to.
Sure.
But Smile Keepers is a preventive program.
Right.
Untreated dental caries or dental needs is a restorative, again, the type of work that we've always emphasized at First Five is toward preventive care and trying to keep the kids from getting cavities.
Correct.
Once they have a cavity, no amount of Smile Keepers, no
Correct.
amount of fluoride will fix that. It
Correct.
requires them to get access to the dental plan
Correct.
that they're assigned to and actually get treatment to restore the health. So again, 23,000 out of the 144,000 people who are on Medi-Cal dental, that's a small number, and it's certainly a wise sample that we're really seeing a very important part in providing preventive care to, that percentage. But the other people are not getting, I guess you could say that at least 29-30% of the 144,000 that are on Denti-Cal need to be seeing a dentist immediately. And this is, again, a preventive service. So I'm just being, I would be more, I'd like to go into detail about the measures by which we look at that in your plan at a later date.
Sure, thank you. But you actually gave us a good segue to the thing I was going to say next, which is because it is a preventive service, it's not a treatment provider, and I believe they really did their best to provide referrals to families. The onus is really not on them to provide that treatment or be accountable for that. So in the current strategic plan period, First Five is now partnering with the Center for Oral Health to better connect that dot. So from the screening to working with that family's health plan and making that appointment for them to make sure that that treatment service gets provided. So we're hoping to see an improvement. It's going to be a different set of metrics going forward. You won't see the same bar chart, but similar. Okay. All right. I want to also point out, so that is a direct service intervention in terms of those child-by-child screenings, but I just wanted to point out some of the systemic approaches as well. So in the 2017-18 year, that sixth dental clinic, children's dental clinic, did get built and is open in Galt. I believe that's the sixth. I saw that written in many places, and we've been waiting for that for a couple of years, so we're excited. And then approval and funding was made for the fluoridation in the Arden Arcade area. So once that is completed, that would bring us to 68% fluoridation across the county. Okay. All right, so the reduction of African American perinatal and infant death. So you all had a fantastic presentation on this, was it 2 commission meetings ago? So I couldn't possibly repeat that for you, but just wanted to highlight some of those big takeaways. So the Cultural Broker Program, as you recall, it's a 3-pronged initiative. The Cultural Broker Program served almost 1,000 pregnant women over the 3 years, and 85% of those babies were born at a healthy weight and healthy age. Then the Infant Safe Sleep campaign trained thousands of providers and parents on safe sleep practices and provided cribs, and worked with the 8 different hospital systems to integrate safe sleep education into their policies and procedures. So again, that systemic approach versus the programmatic approach. We love to see that. And then RSC, with their public education campaign, launched 2 campaigns in the past, counting the impressions data. It's in the millions in terms of individual views as people walked by or saw that media. And then we were really watching the metrics on the upticks to visits to the Sac Healthy Baby website, and we think it was largely due to that campaign. Okay. So now to their outcome data. So over the 628 moms that they had birth data on, there were 2 stillbirths over the 3-year period, but no infant deaths were recorded or perinatal deaths were recorded up to that first month while they still had moms with them. And then we are looking forward to continuing to track the county data. So as you know, there's a couple-year lag in county data. I think the last data that we have is 2016, but between the 2013 to 2016 period, we did see a really sturdy reduction in African-American infant deaths across the county. And really great, too, is the reduction in disparity between the ethnic groups. And then some improvements also in terms of preterm rates and low birth. Okay, so we're going to continue to track those data, both the programmatic data as well as the countywide data going forward. So looking forward to see what the trends look like. Okay, children being healthy is the next result, and First Five has funded Women and Infant Children, or WIC, the Community Lactation Assistance Program, for many years. And over the last 3-year period, almost 15,000 moms were served with lactation consultation services, as well as helplines and follow-up services as well. And the metric that we've been watching here for outcomes is to see the percent of those moms who are exclusively breastfeeding 6 months after their baby was born. And so you can see across the couple of years there that those moms consistently had a higher average or more likely to be breastfeeding than the national or state averages across those years. So good result for WIC. Okay, the next result is we want to see that children are in environments that are conducive to their development. And so 2 major programs are funded here. So First Child Action, Inc. is here with their Quality Child Care Collaborative. We also have the Preschool Bridging Model, or we call PBM Plus. And both of those initiatives or those programs are fairly similar in intent in that we're doing baseline environmental assessments of the classrooms and then creating professional development plans for those providers and their classrooms, and then providing coaching. And we hope to see the quality of those environments improve over time. So we have seen that for both of those programs. Child Action uses the ECHRS, which is an environmental rating scale, and PBM Plus uses the CLASS, both well-established tools. And we've seen really nice pre-post results across the years on both of those measures. Okay, children are ready for kindergarten, probably one of my favorite areas of the whole portfolio. So the initiative here is working, of course, with your 9 school districts, offering really a broad range of strategies focused on subsidized preschool slots, and that has really winnowed down going forward, but in the past is about 400 spaces a year with about 600 children in those spaces. And those were high quality spaces. About 80% were ranked a 4 or a 5 on the QRS matrix. There's also what we call enhanced preschool, so basically the supportive services to the classroom. If we're not funding the slot, let's at least provide some materials and some training opportunities for those providers. There's also been playgroups in place for families and with children 0 to 3. And so this year, one of the things we're working on is an intensive evaluation of the playgroups, trying to see what is happening on a formative basis of how that's delivered across the 9 different districts, or the districts that have playgroups, excuse me. And then looking at their outcomes. So and there's also some other state work that's happening around playgroups as well across many First Fives. Then there's also a transition summer camp in place. So for that one, and that summer camp happens before children get into kindergarten, and that one has been elusive as well in terms of gathering some good outcome data. So this past summer, we took a look at the different tools that the providers were using and said, could we have one tool that gets us to some common measures across all the different playgroups, and so, the transition summer camps, and they were amenable. So we launched that tool and saw some really nice consistent results across kids in terms of self-regulation in kindergarten academics. We also pulled together several years of transition summer camp data and looked at those kids in our fall kinder readiness samples. So remember, we did kinder readiness studies with you for 5 years. And what we found is that the kids who had not had prior preschool had really nice gains. Basically, we're looking very ready compared to their peers in kindergarten. We didn't see those same benefits for children who had already had preschool, and we try to drive as many kids as possible to those spaces that haven't had preschool, but of course we don't turn anybody away. So sometimes when there's open space, those programs still do take other kids. But anyway, some good data for your transition summer camps. And then sort of taking everything all together, we looked at, again with that fall readiness data, when children had exposure to these enhanced or these supportive preschools and summer camp programs, how ready were they for kindergarten? And what you can see is the benefits are really pronounced for children that are lower income. So of families who earned $50,000 or less, 43% of those children who had been in your program were ready for school compared to just 10% of the peers. So if you took away the First Five program, you can infer that just 10% of all of those kids would have been ready for school. But here you are providing the service, and that's boosted that up to 43%. So very good result there. Okay. So families connecting to their communities. So wanted to highlight the 211 program. Again, a big reach program, reaching almost 33,000 families with young children over the past 3 years. And we're looking at what kind of calls are coming in, what people's needs are, and what the referrals are going out. So I wanted to tell you that the number one referral need is for housing. We've heard about this in other counties too, but so it's housing by a big stretch, followed by family and community support, utility assistance, clothing, income, food, and health, etc. But housing is really right up there at the top, probably reflective of the increasing housing costs here in the county. And then 211, as part of its quality assurance, does some callbacks. So about 10% of callers get a call back sometime later to say, how did that go for you? Was that referral useful? And about 50% of the folks reached had received services. We could also flip that around and say, but yes, 50% didn't. And so 36% said they did want a bit more help connected with that service. And we hear that's not unusual to this county, is people want navigation sometimes. Just a number is not enough. But all in all, people did say they were very satisfied with the support, with the 100% being marked there. The next big thing to highlight is your Community Connections grant. So I think it was in the last commission meeting or the one before that, but there was the announcement of the next cohort of CCGs, and you could see just the diversity in the room in terms of by ethnicity or by language or by the focus of what people want to focus on or the area of the county that was represented. So it's just fantastic work that's happening. Those are $5,000 little mini grants that are provided to those groups. We provide a little bit of evaluation support there to those groups, but when you look at the bar chart, you can see just the growth in those groups over time. Over the past 3 years, from 6 groups in the first kickoff year to 8 to 23 different groups, and they're kind of set up in little cohorts. And then we have a ending survey of folks after they finish the program, and you can see by and large people feel it's very helpful for them to make new friends, learn about resources, and say that they'll stay in touch with their peers that they met at the program after it's finished. Yes.
Before you go on, Commissioner Wagstaff?
Thank you, Mr. Chairman. In that area, the community connections groups, this might be a question more for staff than for you, but this data suggests that the folks who attended like going, and we had some positive feedback from them about their experience. But my question is, will we get any information, the commission that is, on whether the children who participated in those sessions ultimately had better health or education outcomes?
I'll turn that to staff to answer.
It's clearly like going, but I'm just wondering what those outcomes were for those
impact?
kids that went.
It's definitely something that we can explore. We currently don't collect client-level data on the children that whose parents attend or participate in these groups, but it's something that we can explore further. We have stayed away from collecting client-level data because it is so tedious with the amount of forms that we would ask the parents to complete, and in some cases, the parents have multiple children, maybe one child that's 0 to 5, and then other children that are older. Alejandra, did you want to add?
Yes, the purpose of the Community Connections grants is primarily to reduce isolation so that the parents are making connections in their community. And every group is so diverse that it's really hard to try and measure readiness for school, even though all the activities are centered around the health and well-being of the children. Reducing isolation is the primary purpose of this group, of these funds.
So we don't get outcome data on whether or not the effort produced better outcomes for the kids?
Other than, are they staying connected?
Okay, thank you.
Commissioner Wirtz?
Good questions. That's somewhat difficult for many of these programs we do, and remembering that this has probably the smallest amount of money being spent on it, and it's one of those that reaches most deeply into the community and goes down to individuals who are willing to do this work. I think the theory behind it, and in fact there's a publication from several years ago from data from Sacramento that demonstrated the value of these in terms of engaging parents in activities that are known to be effective in supporting children. So I think the other thing that we do, we balance in terms of evaluation whether or not the evidence for the intervention is grounded in good science and prior knowledge about whether it works. And I think, as being pointed out, isolation is one of those things that hinders families to provide what they need for children. So I think we trade off how much money to spend on evaluation and how much interference with a small, members of the community, how much we want to burden them with trying to collect this kind of data. And sometimes we depend on the broader research field that indicates things like connections and isolation are of value in themselves. So we don't have that data, but we do have data that suggests this kind of intervention is useful. And we make a decision on where it's worthwhile to put investment in trying to collect this. There are, 355 families, and Smile Keepers or School Readiness has thousands. And so we've tended to focus our intervention or our evaluation on where we feel the investment is most valuable. So hopefully that helps contextualize the limitations of some of this data.
Now that's helpful, thank you. I just, from my perspective though, I certainly understand the issue of isolation and separateness. I get that very clearly, but I'd be interesting to know, and at least from my perspective, like to know if these interventions, if the fact that they get together like this, what that outcome was for the kids who were involved in those families. From my perspective, I'd like to know that.
If I could, just one further thing. One of the things we are trying to do, and again, probably not this one, depending on whether we want to collect at client level, but maybe the next item that at least is going to talk about is the findings across multiple programs. What we really want to see is that families engage in not only communicating with their neighbors, but then look toward going to a preschool or transition camp and so on. So that's another way we're looking at whether there's impact by looking at how many programs we can get families connected to that are of value to them.
Thank you. Okay, So moving into families supporting children's development. So here we want to talk about the Birth and Beyond initiative, which was funded, I think the first year was 2004, really with a focus on improving parenting skills toward the long-term goal of addressing child maltreatment in the county. And services that are provided are parent education classes, home visitation, crisis intervention services, and enhanced core kind of light touch services as well. And so there is a lot that I could take you through here, but in the interest of time, I'll just focus on the home visiting data. So home visiting is using the Nurturing Parenting Program model, the NPP model. And so when a family begins home visiting, they go through what's called the AAPI, the Adult Adolescent Parenting Inventory. And this measure is a risk measure for child maltreatment. So they basically give the index, give the assessment, and depending on how the parent scores on that, they put them in the 3 different tiers of service. So it could be prevention, as you see on the right, intervention, or deeper treatment, depending if they have more needs. And so they work with families, at least weekly visits, could be over the course of 2 months, could be longer. But basically, we're looking first, are we seeing a change on that measure that they initially assessed on, the AAPI? And so what you see in the chart is that across the years, and this is this year's data, we do see significant improvements on each of the dimensions, each of the groups rather, for the AAPI, which is great. Again, that is telling us that there is now reduced risk for child maltreatment in the home. We also get data from Birth and Beyond about the percent of the families that they're working with within the year of service who have a referral to the child welfare system. And so those numbers are about 5% in the 16-17 year and 4% in the 17-18 year. So these folks may have never had contact with the system, or they may already be in the system, but it's looking to see if they have another referral, or it could be a first-time referral. Go ahead.
Dr. Kasiri?
Could you explain the difference between the different groups, treatment versus intervention versus prevention?
Thank you. They actually are prescribed in terms of the level of dosage that they should receive in terms of the NPP model, but I don't have the specifics with me. Does staff want to comment on that?
Stephanie's here in the audience, and she would definitely.
I was going to say, if they're not able to, I can, but Stephanie would be.
Stephanie's our NPP expert.
Yeah.
Good afternoon, Stephanie Biegler with the Child Abuse Prevention Center and the Birth and Beyond program. Each of the families that are in home visitation do a pre-assessment called the AAPI. It is the assessment that's used for the evidence-based nurturing parenting program. It's a scale of 1 to 10, and in the pre-assessment, there is a risk level for child abuse and neglect. So that's done pre, and then there is a post that is done 6 months after service. And this is the difference in those measurements. Steve, I'll let you add to that.
Well, yeah. Just one more clarification, I think, for Dr. Kaseri, that based on the assessments, families are assigned to 3 levels of intervention.
Yes, I'm sorry,
and
yes.
The interventions are essentially different in terms of the number of sessions that a family will be offered. So a prevention family is assessed to not need as much intervention, and so they may only have, and I don't remember if it's 8 to 16 visits versus the intervention site would need more, and it goes up to 35-ish, 34.
52 is the highest for the treatment group.
Okay. Yes. And then the treatment gets more intervention. So those categories are based on assessment of risk and then the level of intervention provided.
The dosage of intervention provided.
Excuse me.
Yes. Is that?
The specific information is on page 62 of the report.
Chairman Cerna, could I also then, you mentioned the low rate of referrals to CPS, and one clarification in the slide is those are substantiated referrals.
Correct.
There.
Thank you.
And I guess sort of thinking about Bruce's comment, so how good is that? And the answer is partly to look at what the county rate of substantiations is during a year following referral to the system. We've worked with a subgroup to work on the definitions of this, because this includes families that didn't have a referral before versus those who did. And the county generally measures, whether I get the right term, recidivism, based on a prior CPS report versus 1 year later. I think the data shown in the separate reports indicates that this is substantially lower than what would be expected in the county without this intervention.
Okay.
Thank you. You said it perfectly.
Right.
It's a challenge because this group doesn't really have a direct counterpart in the county child welfare data that we can get. That's something that's on our task list for this year, is to figure out how to start to get that. Okay. Dr. Kay, is there anything else that we can answer for you right now about the model itself? Thank you. Okay, thank you. Okay, so the last result to highlight for you is we want to see families supporting children's development. And so what we're showing you here is some data for the Sacramento Crisis Nursery, which has been a long part of the portfolio. Over the past 3 years, almost 2,000 children were served, and about 1,200 families attached to those children. And so, as you know, they can come to the crisis nursery for respite care, whether for a couple hours during the day or for overnight stays. And so the report has much more detail about the what kind of stays those were, whether they were planned or they were emergency. So please take a look at that. But what we're looking for over time is, when those families are coming in, what does crisis nursery do to understand what is the trigger, what is the reason why that parent found themselves in a place of needing respite care. And so what we see is that the most common reasons, or the sort of stressors, were employment-related, housing and homelessness, medical issues, parenting distress, or mental health. And then about 77% of those families did complete some case management services, so that's what we want to see, that whatever that stressor is being addressed. And what we also see is that parents are surveyed by the crisis nursery. At the time that they are exiting, about 65% of parents said that the support provided reduced their stress level, and 91% felt that they were better to solve crisis situations in the future as a result of that service. So I often think about with this, we are looking at the percent who have repeat stays to say what more could we do to help those families, but I think, what would happen if this wasn't there for those families? Mm-hmm. Okay, so system sustainability. Julie and her team gave a great description of all the work that's been happening there around the Certified Sustainable Initiative. And so we're trying to keep tabs on how fast that is moving. And if needed, we'll collect some basic metrics around that. But super exciting. I've been talking to other First 5 counties about the work of Julie and her team to say, this is a really neat thing that you can do for programs that we want to help find other avenues for financial support and sustainability going forward. So we're really excited to see that take wings and take flight. But the thing to say about the system sustainability plan is that we were very careful and intentional about identifying 3 different kinds of strategies for the work that was going to need such a plan. So for instance, some results were designated for no longer receiving direct service programming funding, but rather moving to a policy focus or systems focus. But we said we believe that to sustain the outcome, that we are going to need public will, financial resources, and then policy or systemic approaches. So there's a lot of detail about the progress on those different areas of work with those 3 strategies in the reports. I won't go through all that today, but just hearing the discussions earlier today, I'm just thinking that whether it's the RSE work around driving public will, or the financial sustainability work, or the policy work, that's exactly what we want to see. So, okay. So for the current year and beyond, we have been busy with some forms revision for the RAACD campaign, especially as WellSpace moves into providing a different kind of service this spring, so no longer offering exactly what Black Mothers United offered, but more focusing on ultrasounds and a psychosocial worker, so we're doing some measurement for that. Also with Birth and Beyond, as Julie talked about earlier, the CalWorks work that's getting underway in the home visiting. So we want to try to leverage what's already in place to see if that works and is effective, but if not, build some new tools where we need to. The school readiness, as I said, we are deep in the process of launching the playgroup study. So we actually have scheduled site visits to all the different playgroups around the county and are doing pull-out parent discussion groups with 4 of them. Very excited to see what parents say. Back to Commissioner Wagstaff's comment a few minutes ago, sometimes that stuff is hard to evaluate, but I want to hear what parents say the benefit of that is for their children. So we're going to get to do that. Help Me Grow, we were very busy over the summer and early fall in getting that up to speed in terms of clear indicators that we were tracking and forms, and all that is built into Persimmon. And then tracking cross-referrals across the first 5 services. So Carmen showed some data, was a couple months ago, very excited to see we're looking at service needs of families on the family intake form and what referral that given program is giving them. We want to see families better connected across the web of first 5 supports, and so the first quarter data was really starting to show where those linkages are being made. And then, believe it or not, the planning for the trend report and the next strategic plan is going to get underway toward the end of this year and early next year. So that concludes my presentation today. That was a lot of data. I'm thoroughly out of breath. Thank you for the great questions. That always helps me think about what to bring to you next time. Anything else I can answer for you?
Yes, thank you. Commissioner Turner-Johnson.
I just have one question regarding the kindergarten readiness piece.
Yes.
You referenced that across those that you were taking data from, that you tried a more universal tool.
Yes.
And I was checking in the study itself, and it's clear you've done an observation, but is it the Persimmon? What was that tool? I'm curious what the tool was that you used. It looked like it went across most domains, but I just didn't know what the tool was.
Correct. It had some basic kinder academics items as well as self-regulation and social expression in the classroom. So it was a hybrid between a tool that was already in place in one of the districts, which we really liked, and then we added, embellished a little bit from our own kindergarten observation.
You created
form.
your own tool.
We tried to harvest what was there because it was really good and just perfected it a little bit.
Yeah.
And then ran that back by the school readiness coordinators to see how that would work. Very easy to administer, and they said thumbs up.
Yeah.
So
no, it looked good. I was just curious what the tool was. That's all. Thank you.
We should give it a beautiful name, shouldn't we?
Why not?
I don't know if it has a name.
Innovation.
There we go.
Commissioner Wirtz.
Thank you. A couple things I want to say. I want to thank you for the presentation and also just refer us to the full report as having a lot more detail on some of these issues that you can, I think as you said, the beginning of each section has a comparison with some standard that might help a little bit on some of those questions. And so there's a lot of good detail there. The other thing I just want to mention, and I think you mentioned it under the dental, but when we talk about the reach of First Five, we've talked here about clients that are registered in Persimmon and that we have data on the individuals, but I do want to highlight that First Five has worked on policy level issues throughout, and as you well know, we have a reach based on some of these other interventions. We mentioned fluoridation, excuse me, and if you just go back, I'm trying to think, if we take Golden State out, we're at still above 50, I believe, and so there's 117,000 0 to 5 kids in the county, so that would mean around half of them, or 60,000 or so, are receiving fluoridated water, and that's not included in any of these numbers here. The Baby Friendly Hospital Initiative, also there are around 2,000, about 12,000 births. How many births in Sacramento County?
19,000.
Excuse me?
About 19,000.
19,000, right. A good number of those are getting exposed to the 5 out of 8 hospitals that have already become baby-friendly. We have tot parks that are serving our community. We've talked about the community grants, but and then our public education campaigns, not only around the reducing African American disparities, but also under the Safe Sleep campaigns. So I just want to highlight, and then our dental clinics are seeing patients now that they easing the access for those with medical. So I just want to get across to the community as well as our commission that the work of First Five goes well beyond the data that we get to see in these reports here. And then policy changes. I mean, I can't help but mention Dr. Jones's and, First Five's efforts around the dental insurance situation in general. And even though after all this hard work, we've sort of doubled the coverage, but we're still getting up to the state average or whatever. But those are all parts of the reach of First Five that we don't necessarily capture in this part of the evaluation. So,
thank you for that. Very important addition.
Commissioner Jones?
Thank you, Steve, and thank you, Lisa. This was very important and very well done, and I appreciate the information. I'm going to focus again on a couple things. So one is going to be the dental.
Great.
I wonder why. The other is that I had a patient in the office just today, and he's retired, and he's a former involved with the school department, and so he teaches ESL at the food bank. And so he was saying that he had a person there newly arriving in Sacramento from Afghan, and he was having a toothache, and a lady actually, and he was trying to decide how to actually help this person get access to care. And so he, went online, tried to find it, but they found that the most important way in which he got resource and access to resource was the 211. And so he said that clearly connected him to actually not a dental plan, which we are, that provides most of the care for the Medi-Cal dental, but to a FQHC, ELICA in this case, but it could have been the others, because it was clear that they would see a patient regardless of whether they were fully in the system or not.
Excellent.
And I think that's our advantage of what we have done in the grand strategy of the oral health environment, was that we operate in a context of, I think, a challenge in terms of the delivery system. We're the only county in Sacramento, in the California, that has a managed dental care, and I'm not putting a big to-do about that, but that has underperformed in terms of the number of people that have been seen or by that system. So our efforts have been to kind of supplement that with preventive care, with access to care at different safety net clinics, which I think we have done and to provide fluoride. And I think that strategy is second to none in California, period. There's no First Five that has done more for oral health than Sacramento, and I would say it's probably second to none in any kind of strategy in the United States. So it's kudos for that. With regard to how we evaluate our effectiveness, I think I still have a little concern about how that is measured. I think with regard, if we linked in your larger report, which I think has a lot of information, very important information, you link with our preventive strategies, our primary preventive strategies, over a 3-year period, when our fluoridation, for example, has been over 15 years and over 19 million. And so in 3 years, I'm not sure how you, Commissioner Wagstaff's, I'm not sure how you isolate the benefits of fluoride in that 3-year period and the benefits of fluoride versus the benefits of having access to care in a federally qualified health center. So it's difficult. I think you have to do what Steve was saying, was accept that in general, if you have fluoride in the water, that's the CDC's standard of, highly 10 most popular, most important healthcare benefits. So how you look at that, how you grade that, I'm not certain, but I don't think you look at it in terms of children and untreated dental decay, because I think that's not what, certainly a very important measure. It's not what our strategies are about. Right. Our strategies would like to see that. That's about access to care to treat those with a cavity. If they have a cavity, our fluoride varnish, our fluoride is not going to help that. And so our strategies don't affect people with cavities. What you need is for them to see a dentist in a dental office and get a treatment that fixes that cavity. So I would say, looking, and so in the larger thing, it's kind of confusing to me and what we're trying to measure there and what's the most effective way of measure our interventions. So I'd hope that be looked at.
Thank you.
Commissioner Gordon.
Thank you. I just want to add to Commissioner Wirtz's comments and say thank you for the high quality of work on this report, and compliments to Julie and Carmen and others of the staff. And to Commissioner Wirtz's comments, and to Commissioner Wirtz as well for your leadership. I just wanted to add the notion that a big part of all of this work is collaboration among all of the different agencies of the county, all of the nonprofits, and I really want to give a shout out to Chair Cerna and Commissioner Kennedy for really pushing this as a way to amp up the quality and the reach of our services. It's been a huge difference in the last 4 or 5 years because of pushing. We have the city involved, we have other agencies in the county involved, and I think it's making a big difference, but we can't rest on those laurels. I think we have to step that up even further in areas like mental health and other areas where we have an opportunity to deliver services and have stronger outreach through schools and community agencies as we've done. But I'm so impressed and so grateful for the work that's been done. So thank you, everybody.
Thank you. Thank you. And before you leave the podium, I'll certainly, as chair, acknowledge the great work that you've presented here this afternoon.
Thank you.
I think it's obvious that this commission is going to scrutinize especially any data that's indicative of our efficacy, no matter in which realm. But that's a good thing. That's what makes this commission very good at what it does and capable of fulfilling the mission of First Five. So we can't do it without the dashboard. We can't do it without understanding our progress and, quite frankly, being honest with ourselves about where to improve. So that's why your work is so important.
Thank you very much.
Thank you. Okay, next item, please.
Commission member comments?
Okay. Commissioner Wirtz.
Thank you, and I'll be brief. I do want to say that one of the policy interventions across the country that is valuable in reducing child poverty is the Earned Income Tax Credit. And we're now in a new cycle for Earned Income Tax Credit, and the goal is to outreach to communities that generally don't get help with their taxes. Some of our families don't even submit tax forms because they have no tax to pay, and they're not thinking they're not going to get any return therefore. However, the Earned Income Tax Credit does provide resources to families who do not normally pay taxes. They still have the value of getting a substantial return from the government, which many of them are working families and they've earned this money. So the goal, what I'm suggesting as part of our sustainability efforts, a part of our outreach to our partners, is to look for ways that we can promote the Earned Income Tax Credit. There are what are they called? VITA sites that I would like to see us in First Five try to promote those sites, promote our providers to promote them and or become volunteers or hold those sites.
Yeah,
So,
and that's a great point, and it makes me want to dovetail a bit and just let anyone that's listening or viewing know that our local United Way is very much involved with the sponsorship of VITA, which is Volunteers in Tax Assistance. And this past Saturday, I joined Assembly-Member McCarty, the mayor, and others to kick off the season, if you will, and remind folks that they ought to take great advantage of what's being provided. I happen to be at the Grant Union High School site. And just to give you a sense of how much this helps my constituents keep more money in their pocket, last year I should say VITA was able to go from $6 million in more disposable income to $10 million. And so that's not incidental. That's something that we should all be very proud is occurring, because that's more disposable income that can be spent on a whole host of things, whether it be college tuition, whether it be housing, transportation, paying for vital needs in my constituents' households. And so that's why I'm always very eager to help get the word out about this time every year about the fact that April 15th is going to be here before you know it. and we need to do everything we can to flank and support programs like VITA and the United Way. So thank you for bringing that up.
And I just know one thing, that at the state level, one, the governor's put more money into this effort also, but part of the problem is that the families that are most eligible for it, the hardest to reach families, are the goal is to figure out how to do outreach to these very difficult families to reach that are too isolated to have this kind of access. So I'm looking for ways to reach into the communities as much as possible. And the Black Child Legacy hubs are a way to anything that we've done, the community grants, anywhere that we actually are in the community talking to individuals is the way that we can reach an audience that doesn't get to take advantage of this. And I just want to point out that there is strong literature across the country that indicates that this reduces child negative outcomes in a substantial way, whether it be STDs, whether it be child abuse, whether it be homicide, any outcome you can look at. The Earned Income Tax Credit has been shown to be a correlate to better outcomes if people are getting this extra $1,000 or $2 that they get from this. So.
No, again, point well taken, and anyone that's viewing or within earshot of our meeting today, you can Google United Way and VITA, VITA, and it should direct you to a list of sites to take advantage of this tax assistance, tax preparation assistance, which, by the way, is offered in multiple languages. So something not to forget. Commissioner Hassett.
I just wanted to commend staff for two very expertly executed events in January. I think the Raise Up Sacramento event was outstanding. It felt fancy, and the awards that were given out I thought were very appropriate and really showed the linkage between the work that we do and the rest of the community. And then I was glad to be at the sustainability event for the first couple of hours, and it was amazing to see how grateful the nonprofit partners were for the assistance you're giving them. I mean, all of the materials and the process that you're putting them through is such a gift to nonprofits in this community, and I think everyone will be stronger because of it. So thank you.
Commissioner Elliott.
Just really quick to follow up on your comments and also yours. The Sustainability Committee has been talking a lot about poverty and the impact it has on young children and how we can make an impact there. So I just wanted to make note of that we are having those conversations, and the Raise Up event is linking us to employers, which, everything's linked, and the homelessness and the mental health, it's all linked together. And my background's in finance, so often I feel like I'm inadequate to even serve up here sometimes, but it is a really important part of, pulling people out of poverty. And so I'm looking forward to talking about those strategies and how we can partner that way too. So we'll do our best.
Thank you. Commissioner Jones.
I just wanted to highlight an article in the Sacramento Bee today about measles outbreak, and I thought it was a really well done article. And the good news was that Sacramento County has 96% vaccination and protection rate, so it has established a very healthy environment. Not all of the surrounding counties did have that, but it did show how the risk for an outbreak is maybe spreading to California, and that, some of our efforts of reaching our clients, and certainly it's at risk as pregnant moms and a variety of things. So it's, I think that message would be timely to look at.
Good call. I'll conclude by just letting folks know that tomorrow's regularly scheduled Board of Supervisors meeting will be issuing a resolution acknowledging the Rise Up event and all the great work that went into that, and acknowledging, of course, the 2 decades of excellent work here performed by our very capable staff and commissions over the years. And again, just another opportunity for me to at least express on behalf of the commission how proud I am to serve as your chair and doing the work that we do with dwindling resources, albeit, but it's very, very important work, and it's days like today and our previous commission meetings where we see kind of the results of what we collectively attempt to achieve, and so that keeps us in the game. So with that, if there's no further business before this commission, we are adjourned. Thank you.